went from the bonnet, found face down on the floor.
2, 3.
Pediatric trauma.
It's a stabbing quadrant.
25 feet from a ladder onto his back.
He's really unwell, and I think anaesthetics need to see him before he goes to theatre.
Daphne? Daphne?
How is everybody then? Chilling?
King's A&E, how can I help?
King's College Hospital, London.
I got stabbed.
I know, it's annoying.
My head.
One of the busiest A&E departments in the world.
I want top to toe, head, chest, abdomen.
A place where love, life, and loss
Don't bloody die. I love you too much for you to die.
unfold every single day. All the patients you're about to see were treated in just one 24-hour period.
A&E is always like a traffic jam. Can we get a trolley?
You've got to realise that there's awful things that can happen to you.
I'm so sorry.
Life is unpredictable, so it's important that your nearest and dearest know that you love them. You have to tell them that you love them.
You must get better and come back to me. I don't want to lose you.
Because there may come a time when you're not around to tell them.
Hello, King's A&E.
It's quite busy for a Thursday morning.
Adult red phone, 7 minutes. Adult red phone, 7 minutes. I am at the moment. Becky's just on her lunch.
I'm on call from now.
I've worked at King's now for 3 years. I've been working at Guy's and St Thomas's after I qualified. I'd been on a ward there, and I had the chance to go to Afghanistan with the TA. I spent 3 months in Afghanistan, and while I was there, I just realised I needed a little bit more excitement than what an NHS ward can give. So I ended up as an ED nurse.
Turn this beer around, please, Graham. And then is he on monitoring and had some recent obs done next door?
Yeah. What makes King's unique is where it is in London.
Recent monitoring.
Yeah.
Monitoring obs and risk factors.
I don't know if any other A&E has the same mix of people, and the mix of people you see changes what's expected of you. But at King's, you always have to be ready for anything. You can always assume that it's going to be a busy day. You can never predict what's going to happen, really.
Also on shift is consultant Jackie, who'll be the major trauma lead today.
I'm just going to nick to the loo really quickly.
I don't think that's acceptable, Jackie.
Well, it'll be less acceptable if I don't go.
OK, you from prison. We're going number 1.
Jesus is full. How awful this time of morning.
So just fly back. We're just going to make sure you're OK. Just take this one off so I can do a few tests.
No biting, come on, hello.
Right, I've just been punched and bitten by this guy. So I need some cuffs on. If you've got cuffs, I want them on him now. Can you take the leg and this gentleman's going to put these cuffs on him?
Please let me fucking over!
Hang on, relax.
He's bitten me and punched me.
No. Relax.
Just get his shoulder, he will try to bite you.
I'm here to help you, yeah? Relax.
There's no breakers there. We've got a very good security department that work very closely with A&E. The risk is managed as much as it can because the only way to make A&E safer would to be not to let the patients in unless they're vetted.
When you get a chance, can you just double-check his girlfriend's details so we can let her know that he's here? Thanks.
I think the ones who are resistant to us doing what we feel is in the best interest for them, that can be quite difficult. But actually, most people are nice. Most people are really interesting. My favourite patients are just, people who make you feel like you're doing something that's worthwhile, I suppose, because they feel like they appreciate the service that they're getting. So, nice people, my favourites.
Do you want a cup of tea?
No, I'm all right.
Sure. Might have coffee.
bet it tastes like shit though. Yeah. Hello, King's Recess. Lovely. Lovely, thank you. Bye.
Adult trauma, 10 minutes. Adult trauma, 10 minutes.
It's a HEMS call.
Yeah.
Coming in 10 to 15 minutes, 59-year-old male, driver of a van, head-on into another car. Query fractured wrist, he's got a left chest injury, abdo injury, right hip injury. He's been trapped behind the wheel and he's sedated now.
Can we get cardiothoracics down as well?
What's Jackie's number? Head-on into a car, query fractured wrist, left side chest injury. OK, medical students. Yes. This side of the line. Until we've assessed him, it'll be too crowded in there.
Yeah, of course.
Cool.
59-year-old delivery driver Tony has had a collision whilst taking medical supplies to a pharmacy. He's been flown in from Kent by helicopter medics.
Well, the priorities in trauma is first and foremost try and recognise life-threatening injuries, so things that you might need to immediately intervene in to prevent a significant deterioration or death.
This is Tony Arch. He's a 59-year-old driver of a van who went head-on into a small hatchback. He was trapped by compression of the steering wheel on his chest and the dashboard on his legs. He has an abrasion on the top of his head. He's got a left-sided chest injury with tenderness down the left side of his chest, but he's got tenderness across his abdomen and he has an injury to his right leg, possibly at the hip or the knee in that sort of fixed flexion deformity. He's been sedated, he's had ketamine and midazolam.
Okay. And had to be cut out of
Had to be cut out and all been good. He's just been complaining of persistent pain in his right leg, can't get comfortable and he can't feel his right leg as well.
Thank you very much.
That's him. We'll get out your way.
Okay. Airway?
Airway's patent. He has left axilla tenderness.
Oh, fucking hell.
Okay, Tony.
Scratch coming, Tony.
People die in car accidents every day. It was high speed, it was a lot of damage to the car, you know, from head to toe. For someone who sits in a car and drives for a living, there's a chance that he may not recover.
Where's all your pain?
At the bottom.
At the bottom? In your leg?
Oh.
Can you ask him just to wriggle his right toes if he can?
Yeah.
Tony, can you wiggle the toes on your right foot?
This one.
Your other right.
Can you feel me touching on both sides?
Can you feel us touching your feet, yeah? Wiggle your toes for me again. Wiggle your toes again for me. What about on the right side? I know, we're going to warm you up.
I've got a patient here, Delta Yellow, who is going to need a CT from head to pelvis, please. He's a driver of a van, head-on collision with a smaller car. We're just getting a chest X-ray, a pelvis, and one shot of his knee just to make sure there's nothing we need to reduce urgently. And then once we've established that, we'll want to come around for scanning, please.
Can we have a porter to resus to take patient to CT, please?
Just X-ray.
Delivery driver Tony was airlifted to King's 30 minutes ago. Doctors are worried that he could have internal injuries and may be paralysed.
Driver of a van, head-on into a smaller car, trapped by steering wheel and dashboard.
We'll go on slide. Ready, steady, slide. Well done, Tony. Well done.
All right, listen. Okay, Tony, we're going to do this scan of your brain, all right?
Yeah.
And I need you to keep your head dead still, because we don't know you don't have a broken neck at this point, all right? Okay. It won't be long.
Tony's wife Trudy, daughter Tracy and dad Jack have arrived and are waiting for news.
We met when we were 17 and then we got married when we were 19. He goes at 4 o'clock in the morning to work, so we don't get time to have breakfast together or anything. But I always manage to shout down to him to be careful or to drive carefully. And Not that that helped him.
We was indoors. Trudy rang me. He says that Tony's been in an accident. He's all right, but he's been airlifted to King's College, and I thought myself, well, he ain't all right if they've airlifted him. But I don't say nothing. I keep my thoughts to myself, like, you know.
Ouch. Fracture dislocated.
Where?
Yeah. Yeah, it's coming up into the acetabulum. I think it's posteriorly dislocated. So that's the socket there. It's empty. Yeah. No, it's definitely fracture dislocation. The spine, belly looks okay. Spine looks okay.
It's in a billion pieces.
Yeah, shattered.
He was always a laugh. He always enjoyed life. I can remember I took him to football when he was a young lad. He played for the Boys Brigade, and he scored the first 4 goals. And I will say the rest of the team was useless. And there was an old man there with a dog, and he's shouting out, "Give it to the big number 9. Here, put it in the back of the net." So I said, turned around and I said to him, "That's my son."
So what do you want to talk about, sweetie pie?
I don't want to talk about anything. I shan't talk about anything unless I'm asked a question.
Okay, love.
Going out with Karen tomorrow night.
Where are you going?
Status Quo. I only know one song. Do you?
I don't know any of them, I don't think.
I'm sure like it's one of them bands that when you hear it, you'll be like, oh.
It's just the name of it, you can't really place what songs.
The CT has shown that Tony's right hip has been broken and dislocated and his knee joint shattered. Although his spine is not damaged, doctors are concerned that Tony is unable to move his right leg, so may have suffered major nerve damage.
The sciatic nerve supplies basically the vast majority of muscles and things in the back of your leg. It's got a huge impact on the way your leg functions, normal walking, standing, all of those sorts of things. So if he ended up with so much pressure on the nerve for such a long period of time that the nerve died, then he would end up with significant impairment of his function at the end of that, because a big portion of his leg just wouldn't work properly.
Hi. Are you? Oh, hi. I'm Jackie. I'm the trauma consultant. How are you?
The orthopaedic team have been called to prepare him for an emergency operation to reduce the risk of permanent damage to his right leg.
Have you seen the CT scan already? Is that
Yeah, we saw them. As they came through, and it does look like the acetabulum's involved. Yeah, he's presumably got some sciatic nerve neurology as well.
You can't move.
No. And then if I get his family in, is that all right? You finished talking to him? Do you want to come in? I've got some people here for you.
Yeah.
In much pain?
Yeah.
Yeah, I'm there.
Oh, hello, Tom.
Where?
King's College.
Oh, bloody hell.
Try to keep still, Tom. I know it's painful. Of course, he is the provider for the family. He's always been driving, and so I don't really know what else he could do.
It does bleed and hurt, doesn't it? He's never been lazy. He's been a butcher, a postman, a milkman, and worked for the medical firm, delivering drugs and that to hospitals and pharmacies. He's like me, I've always worked. You've got to be busy. It's like when I retired, I thought myself, you know, it's going to be lovely, but it's not. If you worked all those years, it's hard to come out of that way of living, like, you know, getting up at a certain time and working to a certain time.
Please can I have a quarter to recess? That's a quarter to recess.
85-year-old Eric has come to King's with an ongoing stomach complaint.
Lots of people here today, isn't it? Mister? Lots of people here today.
Yes.
Eric is my world. He is my ideal man. Okay. You don't want to sip?
Well, I might take a sip, yes.
Okay, just a minute. I waited for someone like him since the age of 26. Oh, it's all right. I didn't have to put my gloves on. Wouldn't have been much use. They have to be rubber. After I qualified in chemistry and physiology, I got a job at Maudsley Hospital doing some research work, and I met Eric in the canteen. One gets talking to people from other departments. He was a nice chap. And one day in 1965, 66, somewhere around there, I met him on the road just outside Ruskin Park. And he said, Helen, would you like to go out with me? So I said, all right. So we went out with each other for a few times. We went to the pictures and for drives. He had a little car.
I'll have to go and go to the loo.
Okay. Give me your coat. I would have married him straight away, but he wanted to live together to see how we got on with each other. Well, Auntie and Uncle who brought me up were very strict, and I didn't feel comfortable about that side of it, so we parted. We met again in 1993. I was 57 and he was 65. I went to see my doctor. I was waiting in the waiting room, and who should walk in but Eric? He had the same doctor, it appeared. I didn't know he lived so near me either. And this time we took to each other, no, not like a house on fire, but you know what I mean. By the way, when you went just now, did you go number 2?
No.
Oh, you didn't? Okay.
I did a really good horse part.
What?
I did a really good horse part.
I thought, you know, that was one of the happiest days of my life. You know, fate acting in that way. And we've been happy ever since. We've been together for 20 years, a little more than that, and we love each other. If we'd have had a son, I would have liked him to be something like Eric.
What is it that you like in a man?
Goodness. He must be a moral person. He doesn't have to be handsome, just a nice, simple person with goodness in his heart. That's all.
I'm Lucy.
Hello, darling. I'm Jim.
Hi, Jim. Nice to meet you.
Nice.
Anything you need, give me a shout.
Okay. Help!
Adult trauma, 50 minutes. That's adult trauma, 50 minutes.
I've got no fear of hospitals.
That's fantastic. That's good to not have fear.
And I'm usually quite fit. But at the moment,
The breathing's just stopping you, is it? Slowing you down a bit.
79-year-old Jim has been brought in by ambulance with breathing difficulties.
Have you got what other medical problems do you have, Jim?
Well, I had a sigmoid cancer when I was 71. I was upright and on my feet the second day. My surgeon reckoned I was Mr. Indestructible.
Yeah.
So I am a man that recovers quite quickly.
Yeah.
And I am reasonably strong for an old man. Done lots of jobs. Anything physical. If I did anything, if I was digging, I'd dig down until we got to Australia. Or if we were building anything, I'd build until the top's over. Anything. I think I'm as fit as I am now, simply because I've always looked after myself.
Yeah.
I still train with a spemmy bar, which is an 80-pound spring. And I still do a bit of training for the martial arts. I haven't retired in the sense of I'm still physically doing things. Gardening, cooking, shopping, making beds, all the general duties of an housewife. Because a housewife's work is never done, so I've been told.
But all your observations are fine. Your blood pressure's not, your heart rate's a little bit raised. But if you've been struggling with the breathing, and I've just done a heart trace, and I'll just quickly whip off another one, actually.
Okay.
Lovely.
I feel a bit of a fraud at the moment.
Oh, don't be silly. You're not a fraud. What we'll probably do is get a chest X-ray. I can order that now, just to make sure that you haven't got any infection down there. I'll check your temperature as well. All right? And if you do get in any discomfort, like I say, I'm Laura, so give me a shout, and we can sort that out.
Yeah.
All right. Pop this under your tongue. I'll get you a gown as well. I'll get you a gown to cover yourself up, or you'll have all the ladies passing out.
I don't think so.
Hey, I saw a lot younger, look a lot worse.
Sorry,
Ambulance services are bringing in a male patient under police escort. He's been arrested following a high-speed car chase.
Driver, no seatbelt, ended up on the passenger's lap. Complaining of C-spine pain, lower lumbar pain, and he's got a laceration with the right side of his pelvis and recurrent pelvic injury. He's got pelvic splint on.
I like to think I approach patients in custody in the same way as I approach the same person who's not in custody. Just because you're under arrest doesn't mean you did it, for starters. And the reality is that it's actually not for me to judge what they may or may not have done. Our job is to look after the sort of physical and emotional well-being of the person that's in front of us.
Oh, hi, is that the radiology registrar? I've just got another trauma patient here. He was the driver of a car being chased by police. He was unrestrained. He's got a wound across the right lower quadrant, complaining of some back and neck pain. Have we had a chance to get his girlfriend's details?
They're on the phone, which is in his pocket, which is at scene, but we've got his mum's details and they're just letting her...
You're sorting that out, brilliant. Section 2.
Because of the type of accident you've had, it's very important that we just treat it as though you could have an injury to your neck until we get the images. As soon as we know that there's no damage, we can get you sat up and a little bit more comfortable, OK? Yeah. It's King's College Hospital in London.
Got a change? You want to change? Yeah, cheers, mate, yeah? Thanks a lot, yeah?
Sweetie pie.
cold drinks ain't working.
Oh, it'll be hot drink then.
I'll just get a packet of crisps or something. I don't really want a drink.
You don't?
No.
Yeah. Which one? This one? Oh.
Point corridor. Pinpoint corridor.
What the fuck, eh?
How are you?
I am fine, young lady. Thank you.
One of the nurses, okay?
And I am Jim.
What happened today, Jim?
You ladies have got me here and I want to go home.
You're making me feel bad, Jim.
I worry over my wife. She's on her own, or she would be. She's not on her own at the moment because my son will drive down from the coast to be with her. She's such a lovely lady. Yeah, 5.
Jesus.
None of them are called Jesus.
How long are you married?
60 years next year,
Oh my God.
so it's a little bit long. She was 14 when I first met her. She was beautiful.
I can't believe you've been married nearly 60 years.
Yeah, she's possibly worrying about me. So if you could bring her, I'd be well pleased.
And you
Just tell her I'm all right. Thank you, honestly.
And you've been well looked after.
Yes. Tell her I'm chatting all the ladies. She knows at any rate. And tell her I'm raring to go.
He says he's raring to go. She says you're to behave yourself.
Yeah, she always does. I met her, she was 14, I was 15. When we were courting, I'd walk her home and pick flowers from her. And yes, I used to nick them out of gardens. But really, I didn't nick loads of flowers, a few daffodils when they were in season, roses. But I always pruned them. I never just pulled them out the ground. Well, years ago, I got pulled up. I was coming home from school, and my mum was quite poorly at the time, and I nicked a rose out of a garden near the school I was at, and I got down the road, the police pulled me and took me back to the house. And the bloke come out and he says, what's the rose for? So I said, well, because my mum's ill. So he walked over to the bush, he looked at the bush, he came back and he said, you like flowers and you've done the right thing. You've cut it, you've not done anything else. If you want flowers for your mum, knock on the door.
The patient in custody has been surrounded by police and security.
He was RTC, he was evading, didn't stop for the police chase, 40 miles an hour, rolled his car.
Something my other patient tried to do a runner. I missed it too, I just heard about it. Apparently he stole the shoes from the guy next door and then tried to bolt. Fool.
Can I leave you to get in back into resus while we...
I'm going to speak to him.
Police are waiting for backup to escort the patient to a secure bay for treatment.
He's in handcuffs at the moment.
Yeah.
They want him to stay there.
So even with this many security, they'd rather him on the floor here than in a cubicle. When we get a patient through who is either agitated, confused, aggressive towards staff, it's not unknown for us to have 5 security guards, a couple of nurses, a couple of doctors, all dealing with that situation. And while we're doing that, it leaves no staff to look after the other patients.
Wandering around and whatever.
So even with the security here, can we put him on a trolley, still handcuffed and take him back?
Until we get extra police officers.
Right. I have to go back to resus because I'm trying to deal with something much more serious. Will you come and get me if there's a problem?
Really? Don't keep moving about, Tone.
Tony is about to undergo the first of many major operations to restructure his shattered right leg.
Tony, so I think what's going to happen, one of the doctors needs to do a bit more, do a little procedure down here. So what we can do, we can give you some more of the morphine for now to help with the discomfort you're in. It will also mean that when she comes to do the procedure, it's going to be less uncomfortable for you. Are you happy if we do that?
Yeah, carry on.
Let me go get that ready and then I'll come back, OK? It'll be one moment.
Just as well, Eileen never come down at the moment to see him like that.
Yeah. That's right. It's horrible, isn't it? Seeing them like it.
All right.
All they want is their mum. I know, it's horrible seeing him like it. I bet all he wants is his mum. You know, you don't care how old you are. Ring Nan. Shall I go out and ring Nan? I'll pop out there, yeah? All right, you come on this side.
Well, my wife wouldn't want to go to King's because our youngest son died there. She didn't want to go there after Dean died. You know, too many memories. And it upsets her to think of it. Because I don't think she's ever accepted Dean's death, you know. Not like me.
Hello, Nan, it's Tracy. Hello. Right, he's awake. He's in quite a lot of pain at the moment. Yeah. No, not yet, because he's going to need another operation after this. He's all wrapped up. I'm saying it looks like he needs his mum. Yeah, I know.
He really misses Dean. He's never forgotten him. We would have loved to have heard his brother about. Dean was 17 when he died. He had a brain hemorrhage. He was the opposite of Tony. He's very academic sort of thing, a bit more serious.
Go out? Yeah.
He hung on for about a week in intensive care. Then he died. Tony sat with me. We stayed there. We didn't come home at all. We stayed there all night long as well for about a week. So I don't think I could have got through it without my eldest son being with me. As I say, my wife couldn't be there, so I'd have been by myself. Can't explain to people how you feel. You know, you're not really on this planet. Because you don't ever expect for your children to go before you. So your mind's never sort of prepared for it, isn't it? Well, mine wasn't, and the wife wasn't. Well, I'm not one of those people who go to seances and that, but I'm sure he came and spoke to me once. I can remember it vividly. I was in my bedroom. I'm sure I heard a voice say to me, "Dad," and I might have been dreaming it, "Don't worry, I'm all right." And since then, I'm not really worried about it. You know, I miss him, but I think it's just something that came.
Sorry?
It started out such a nice day.
I know. You didn't quite expect that, did you? Just give him again.
To relieve the pressure on Tony's sciatic nerve, surgeons will first need to put his hip back in its socket. For the procedure, Tony has been heavily sedated.
You're doing really well.
They will then need to attach a weight that will hold Tony's hip in place by drilling a hole to insert a metal rod through his ankle.
Tony, take a big breath for me. Tony, that's it. And another one. Can you put 100 over 50? Press mute or something.
Don't look like there's anyone that's got anything urgent, no?
No. Well, no one looks really in here, do they? No one looks bad, do they? Nothing obvious, really.
No.
Oh, Laura, you are a card. Yes, she is.
You're a card.
You are a card.
Jim's waiting for the results of his chest X-ray and blood tests.
It's not a tart, just a card.
A tart? That's Jim.
I heard him say it.
Did you call me a tart?
No, you said you called me a tart.
Did you want a taxi or what?
I'm being threatened over here.
Jim, I would just like to alert you to something.
I can't see it. I've got no glove. Yes, you can. Your choice of treatment. Stop abuse of the end. I wouldn't abuse you people. Think you're beautiful, all of you.
Dear, yes.
And in fact, if anyone did, I'd be the first to help.
Oh, Jim, you're a good one.
I don't cheat. I don't rob. I always keep my word. I'm friendly with anybody that would be friendly. I treat women with respect, men with respect. And when they don't, then there's an opposition. I don't drink as much now. I used to drink a lot. If I drink, sometimes I get into a fight. But I haven't had to lose it since I was 71.
Really?
Yeah, silly boy got a little bit silly. So I just, boom, knocked him on his bum. Best form of defence is hit him. Straight away. I've been brought up like. My boys look after themselves. I taught my girls to punch, my wife to punch. We're all good at it. Now, it's my 80th birthday in May, so...
Are you having a do?
I don't want one. It's all fuss, isn't it?
Oh, I don't know, you know, you get presents. That's a fairly good incentive.
I've got a family I love, a wife I love.
Well, what more can you ask for, I suppose?
I'm not worried about money. I haven't got any, but don't worry about it. Family first, last, second, anywhere you like. My family are what it's all about. Without them, I'd be lost.
With his leg now in traction, Tony's ready to be taken to theatre, where he'll have the first of several operations.
Uh-oh. Hello. Is that through the ankle?
She said they've put a bar in there.
Through the ankle?
No.
Looks like it's through.
Oh, yeah, it is, isn't it?
It's a good idea, Mother. She'll be up tomorrow.
Yeah, so look.
Nice.
You don't like coming here.
No, but she'll be up tomorrow.
She will.
Don't worry about it.
Oh, all right.
All right?
Yeah.
Hang in. Hang in there.
Oh, you want us to go? You sure? All right, then. All right, see you later.
When I saw him in intensive care, I was very worried. When we went in to see him, because he looked absolutely shocking. I mean, he had so many tubes coming out, it was unbelievable. Because he was dangerously ill, Tony, very ill. They put a drain in his lung, and that's where the trouble started, because once the drain came out, he started filling up with blood. And he got blood clots in there. I thought, let's not have another repeat. Let's hope he comes out of here.
Fucking hell. Oh. That's why you don't go to sleep, you mug. What? What? Don't go to sleep. You're falling off the chair. Stay awake.
Do you want to assess him on the chairs?
I'd love to.
Do you? But try and make him... I'll come with you. I'm going to make him move. Hello, mate. You all right? Now, listen, I hope you don't mind. Can you just move on to those seats? I don't mind you lying all over them, but I'd like to just keep a little eye on you. If you have a fit, I can't see you because you're behind a wall that is solid and I can't see through walls, and I'd much rather you sat over there. Come on.
My chair.
So, excuse me, it's not your chair, it's hospital property. I will get you a cubicle and then you will have to move. So please, in the interim, can you just move over there? Because I've asked you to.
Why can't I sit in this chair?
Because I would rather keep an eye on you, sir. Come on, you can lie all over those chairs. Thank you.
This one.
I would like you to sit over there, please.
Give me that tone of voice.
Well, then do as you're told, would you? Thank you.
Don't be.
Thank you very much.
That's it, wait and see.
Just sit there. That's not very nice. You don't even know me. Doesn't like me. Never mind. Verbal aggression, we probably have every day, more than once in a shift. Physical, for myself, I've only ever been thumped once, and that was an 85-year-old lady who was a bit confused. I put her cardigan on and she went wallop and knocked me straight on my arse.
Jim's x-rays and blood tests have come back clear. Transport has been arranged to take him home.
I've hit a mid-morning wall.
Yeah. Do you know, I'm knackered now. I want to sleep. No, I've been up since early this morning.
We need to get some sleep. We've been up 22 hours.
Yeah. But it's good for you.
Is
to have work it off sometimes. That ain't my driver, is it?
Yeah, it is.
Is it? You my driver?
Shall we give them...
Listen, girls, I love you all.
Lovely to meet you.
You're beautiful. And all
Nice
of
to
you.
meet you.
Pleasure, Jim. You take care. All the best, all right?
Nice to meet you. Get home safe. Look after that wife of yours.
Bye, doll.
Bye, Jim.
Bye, Jim.
Oh, I like Jim.
What are we going to do now, man?
I wanted Jim to stay. Should have kicked out the horrible ones and keep Jim.
They're all right, though, in here.
There's someone kicking out front being racist. If Jim sees her...
He's very ethical.
It's very ethical. I like Jim. I thought he was going to be a hugger.
I got a proper squeeze.
I did a big kiss and a squeeze. I was like, oh.
Me too. Happy time.
Oh, Jim's made our night nicer.
He has. Got a little cheeky kiss.
When I knew I was in King's, first thing that came into my head, Dean died here. But I must say, I was glad I was there because they were just absolutely fantastic.
And what do you think's made Tony the man he is today?
His upbringing, definitely. What he's learnt of his mother. She's kept him on the straight and narrow, all of them. They're not perfect, but they do me. I think they're lovely.
I must admit, I do get bored because I can't leave the house because I can't walk on my right leg. I just get so excited if I've got a visitor coming. If I know that I've got someone coming on a certain day, I sit there looking out the window until they turn up. And I'm not very happy if they don't turn up.
Slow down. I don't think that'll happen. When you see me walking, I walk like I did when I was 20, and that's the way I will go. So no walking sticks, and none of that.
Ah. Yes.
Give it to me, come on, let go. I like everybody to be as happy as Eric and I are.
I love you.
Yeah, I love you too, you Rich.
That's right.
Thank you.